Then we'll be talking about the spinal nerve formation, right? Who studied this topic? Did anybody study this topic?
Yes.
Yeah? There is like the innervation of the dorsal part of our body, anterior part, ventral part, different kind of regions. So we have, in neuroanatomy, we use some type of the color. What are they? What kind of color we use?
Green color and red.
Blue, green, red, right?
Yes.
So in this picture you see all these three colors we are using. This picture is for formation of spinal nerves, right? And why do we need these spinal nerves? Who knows that? Why do we need
To the
Parts
central
and
nervous system.
central nervous system and to connect organs, internal organs, right? So let's discuss. Let me explain the first picture. So we have here what? Which structure is here? The spinal cord. This is which portion? And why is it so? Yeah, why is it so? Why it's anterior?
Because there is a fissure.
There is a fissure. This is the sulcus, right? And the next one. And inside of that we have the butterfly shaped. What kind of matter? This is the
Gray
gray
matter.
matter. Yeah. In the gray matter we have the horns, posterior horn, in the intermediate lateral horns, and the anterior horns. Yeah. That why we need the posterior horn? What is the cell bodies of the sensory tract, right? The anterior horn is motor one, and the intermediate lateral for the autonomous vectors. Yeah. The next one we have here what? This one and that one. Ventral, radix anterior root or ventral root, and dorsal root, right? Radix posterior here, and then we have the circular big structure in the dorsal root ganglion or spinal ganglion. Yeah. What we can find inside of that?
The localization of the cell body.
There is a pseudo-unipolar body shape, the first neuron, the first cell body of the sensory tract, right? So then we have some kind of structure. What? Intervertebral foramen. It's between two vertebrae. We have the. So up to now, you know all the structure, right? This is the anterior part, posterior part, the radix, anterior, posterior. So they fused and they formed here one important structure is spinal nerve. Okay, let me write down here. After the passing and exiting this portion, now we call this nerve as a spinal nerve. Okay, first let me explain the easiest one is the blue color. Please pay your attention to the arrows. As you see here, we're bringing information from the periphery and delivering to the central nervous system by the first second neuron to the spinal cord. Okay, so guys, if I press my back, do I feel this touch? Do I feel this pressure? We're bringing from that surface through these branches. Yeah, as you see here, we have the dorsal branch and the ventral branch. Okay, dorsal branch goes to the dorsal part, our back. And the ventral branch goes to all my anterior surface except my head, because the head is innervated by which nerves? Cranial nerves, right? That's why we don't talk about the head. So the next one, let's talk about the blue color. So in the blue color, we innervate what? We get the information from the skin, for example. We can apply some pressure, the cold, right? The heat. And we'll bring the information from that surface, and we'll be going like entering the spinal nerve and traveling to the dorsal part, right? And reaching the first neuron where? In the dorsal root ganglion. Body shape is pseudo-unipolar. There is no synapse between, right? We'll bring to the cell body, then we'll exit to read our second neuron in the posterior part of the spinal cord. Okay. Then I skipped another information. There is one branch, meningeal branch. What's that?
It
Comes back to the
It goes to the spinal cord meninges, right? For example, some patients can have the increased pressure in that, or maybe this meninges can get inflamed, so the pain will be delivered by this nerve. Okay, that's why we bring the information. We travel we join with these fibers and entering the same place. The next one is our anterior surface. It goes like the same way. Yeah, we're getting the information and traveling back to the spinal cord and delivering the full information. The next one is, so I have one question, guys. Have you ever had stomach ache? Yeah, for example, some of the students have the gastritis, the inflammation of the stomach, right? Sometimes you have hungry ache, hungry pain. Yeah, you feel this pain, right? You should explain. You should understand how you feel this pain. We should bring the information from the stomach, right? This irritation of the nerves will take the information. We should deliver to the spinal cord, the central nervous system, and to the head, right? So for that, we have some complicated structure here. As you see, this triangle here. A triangle is formed by the RCA. That's called ramus communicans albicans. Yeah, white communicating branch, and we have the gray communicating branch. Yeah, the first one, grisaea for the gray, the albicans for the white. Yeah, as you see here. So let's say this is which organ? The stomach. We are taking the information from the stomach, going to the through the splanchnic nerve. You can ask from where did we get this nerve? Let me explain. So returning back to the ramus communicans albicans and grisaea. If you see here, the first branch comes here, the second one exits. So why is it albicans, why is it gray? To understand that, we have to go back to the paras or sympathetic innervation. If you see here, what's illustrated here? This is the first neuron of the sympathetic tract, right? Which portion? Intermediate lateral cord of the spinal cord. This is the place for the first neuron cell body. We exit, right? I forgot to draw here the arrows. We exit that place and we go to the spinal nerve and we enter ramus communicans albicans. And can you tell me, please, guys, from the course of histology, nerves are surrounded by what? Myelin sheath, right? So myelin sheath is formed by lipid structures. Yeah, do you agree with that? So why is it albicans? Why is it gray? It's about the presence of the myelin covering in these nerve fibers. If you pay over here, this is the first fibers. Yeah, we have it is pre-ganglionic fibers. It's before the synapse. This kind of nerve fibers we call pre-ganglionic. Do you agree with that? So then we travel to the ramus communicans albicans. Then we have this big structure. It's called sympathetic trunk. Sympathetic trunk is formed by the sympathetic ganglions, and from that trunk we have some splanchnic nerves. Yeah, these nerves goes where they go to the organs, internal visual organs. Okay, so why that was ramus communicans albicans? If you see here, we are bringing pre-ganglionic fibers to the ganglion. Then we are forming synapse, and some of the fibers leaving this ganglion and exiting this place, right? It means postganglionic fibers have less myelin sheath than pre-ganglionic fibers. That's why, in appearance, if you cut the structure, you can see this will be more white. That will be gray. Is it clear? That's why it's ramus communicans albicans. That will be the grisaea. That was explanation of these abbreviations. So returning back to the stomach, about the pain feeling, we discussed all the ramus meningalis, right? About the pain in the meninges, the irritation of the meninges from the dorsal skin region, ventral skin region, and the pain in the stomach. We should take this irritation to the nerve, and we are passing through the splanchnic nerve, then reaching the sympathetic trunk. We are bypassing these ganglions. The neuron, the sensory nerve fibers, they don't form synapse there. Okay, they will just bypass the structures in order to get to dorsal root ganglion. Is it clear? We're just passing through that structure, yeah, making like some bypass there, and entering the same nerve bundle which was coming from the other parts of the body. Is it clear? That was for sensory innervation of the body, including the organs and the skin tissue. Okay, with the meninges. The next one will be what? The next one will be the motor innervation. And can you guys, please tell me where is this first neuron of the motor tracts? It's always in central nervous system. Don't forget about that, okay? As you see here, in the anterior horns we have first neuron cell body, and do we have second neuron in the motor tracts? In the motor tracts, do we have second neuron? It's always one neuron pathway, okay? We have first neuron, there's already a target cell, target organ. Is it clear? That's why we have only one neuron. They travel, they exit the anterior horn, they travel through the radix anterior, forming the spinal nerve. And tell me please, do I have in my meningoskeletal muscle, in the brain covering the spinal cord, the membranes, do I have skeletal muscle fibers? No, right? I don't control, I cannot move my meninges, right? That's why if you see here, there is no red fibers going to the traveling to the meninges. And can you tell me guys, can I move my stomach? Yeah, that's why if you see here, there is no red color. Yeah, the next one will be the dorsal branches and the ventral branches. So do I have my anterior some muscles here, ventral group of muscles and dorsal group of muscles, right? For example, I can flex, yeah, I can extend, yeah. These fibers travels through the spinal nerve, goes to the dorsal branch and the ventral branch. Innervating what? Motor muscles. Yeah, it's not smooth muscle, don't mix them. Is it clear why we don't have here red fibers, the splanchnic nerve, sympathetic ganglion, the meningeal branches? The next one will be what? The next one will be the important structure is sympathetic nervous system, and its nerve fibers, bundles, plexuses, and so on. Can you tell me what's the function of the sympathetic nervous system? Yeah. You know, fight and fly, yeah, fight and fly response, yeah. Under the stress situation, when you see a bear somewhere outside in the forest, right, or maybe there is some stress situation. What kind of stress situations you know? Just give me some examples.
Neuroanatomy.
Yeah. Sometimes you'll be sweating all the time, right? During exam, it's also part of the sympathetic nervous system. So the sympathetic nervous system, is it afferent or efferent? Efferent or descending or ascending? It's a descending. Descending. We're giving signals. There's always efferent, descending. Okay? So that it means the first cell body is always where? Is always in the central nervous system. Don't tell me that we have first neuron cell bodies inside of plexuses, in the ganglion, in other parts. Okay? Always first neuron will be where? In the intermediate lateral part of the spinal cord. Okay, let's talk now about the sympathetic effect of the stomach. Yeah, what happens in the stomach under the sympathetic control? Yeah, that's right. We don't use, for example, under stress situation. Do we use our stomach? We don't use, right? Under stress situation, we need more oxygen. We need more blood supply to our skeletal muscles. Yeah, the organs, the structure which we'll use during this fight and flight response. Yeah, the next one and. What happens to our arteries under the effect of the sympathetic nervous system?
The pressure
they
contract.
Yeah, they contract in order to what? In order to increase
the
blood pressure, right? And what happens to the skin? What happens? Blood supply decrease, and what do we have inside of the skin? We have what? Hair. What happens to the hair? Erects. Why do we need this response? Why our hair erects under stress situation? And for example, do you have cat? Yes, domestic animal, right? Have you ever seen that the cat is increase the erection of the hair, right? Yes, it will try to increase his body size. Yeah, to make it bigger. Yeah, because maybe your, for example, cat can meet some dog. The dogs are usually bigger than the cats, right? The cats will try to frighten him, yeah? That's why we use our sympathetic nervous system. It will be acting on what muscles?
No.
Erector pili muscle. The muscle which is responsible for contraction of that muscle, so we can just increase the it's not about increase, we'll just erect the hair. Is it clear? So we'll increase our size. The next one that was the arteries and the skin. Is it clear with that? And that was with the stomach also, right? So guys, the next important structure is that, as I told you, the first cell bodies is always in the central nervous system. We exit through the anterior horn, radix anterior, forming spinal nerve. And as I told you, we enter what? Here, what you see? White communicating branch, right? We enter that place, and if you see here, we have here the one, like the line, and we have just spotted line here, right? There is a difference. And the next one, so just I want to say that we have some nerve fibers of sympathetic nervous system forms here synapse. Okay, some of them they will bypass, they will just move, they will make a loop around them, and they will exit that place by splanchnic nerve. And I will tell you why some of the fibers will form here synapse, some of them no. So can you tell me that how many organs we have? Approximately, how many organs do we have in our body? Yeah, it's just about 20, 30 maybe, right? What about the vessels? How many vessels we have?
So many.
Yeah, a lot of, right? It's really long, the system of the vessels, starting from our finger and going to the brain and so on. So for our body, our organism, it's easier to make some ganglia next to the spinal cord rather than making this kind of ganglia along the course of the arteries. Just try to imagine how many ganglia we should form in our body. Yeah, that's why it's easier to our body to make one ganglia here rather than making all the body along the course of the artery. Is it clear? That's why the branches of the sympathetic nervous system, which goes to the meningeal part, goes to the dorsal part and ventral part, they are postganglionic fibers. Okay, if you look, if you pay attention, the fibers which goes to the organs, they are still preganglionic fibers without forming any synapse. Is it clear? Yeah. The next one will be, for example, inside of the meninges. If you see here, we have still green color. Why is it so? Inside of the meninges, we have blood supply also, blood arteries. They travel to the blood arteries, okay, blood vessels. Is it clear? Yeah, preganglionic fibers will make synapse, it's not anastomosed synapse here in the sympathetic ganglion next to the spinal cord. Then we'll take postganglionic fibers through the ramus communicans grisea, go to the meningeal branch, look at the arrows, we are efferent, we are going to that organ, going to the dorsal region and the ventral region. Is it clear? Where's the first neuron?
Central
in the CNS,
nervous.
the second neuron will be where? In the sympathetic ganglia. Do you agree with that? This is the second neuron, right? What about the organs? It's quite difficult. So the first neuron is always in the CNS. It will make that course, it will bypass that, and it will form between two ganglia. We have splanchnic nerve. It will go right directly to the organ. So inside of that, we have what kind of, is it preganglionic or postganglionic? Still preganglionic fibers. They are traveling, going to the organ, right? And then another question, how our nerve fibers, nerve bundles, they travel to the organ? How do they travel? Yeah, how? They will be traveling on the surface of the arteries mostly. Do you agree? We usually say this is the bundle of the artery vessels and the nerves. They always go together like that, for example.
Kidney and bone?
Yeah, usually like that. If, for example, we have celiac trunk, you remember? Celiac trunk, yeah? What's that celiac trunk?
That's in the
Yeah, this is the main arteries which supplies the kidneys, the duodenum, the stomach, the spleen, and so some part of the esophagus, right? So we use these structures to get to our organs. It's easier, right? Just celiac trunk or superior mesenteric artery, inferior mesenteric artery goes to the different parts of our GIT, right? So it's easier just to jump on them to reach that place. Yeah, that's why we have some plexuses. What is plexus? Yeah, interaction of this kind of different kind of nerve fibers forming a network, plexuses, right? Inside of the plexus, we could have what? The ganglia also. Okay, inside of the plexus, we could have cell bodies. Okay, in that cell bodies, we'll have second neurons of the sympathetic nervous system. Is it clear? So your task will be to learn to study the different kind of plexus. What kind of plexus we have inside of our body? Okay. What kind of plexus? No, I'm talking about the internal visceral celiac plexus. One. Aorta-renal plexus. Aorta-renal plexus. The superior mesenteric plexus, inferior mesenteric plexus. That plexus which you are telling, it's somatic, it goes to our muscles. They are going where? They are going to the organs. Is it clear? Yeah? That's why you should memorize that your task is to study the plexuses. What kind of plexuses? So for example, you'll be telling me the innervation of different kind of organs. For example, you'll be telling sensory, sympathetic, and so on. For example, now in the end of this lesson, I'll try to innervate with you the stomach, okay? And I'll take, for example, the kidney. I'll show the difference. So then we have first body here. The second cell body will be in the plexuses, or it could be inside of the wall, next to the wall, near to the wall. We have some ganglions. They are called intramural, and we have paramural ganglions. What does mean intra? Inside, or inside, or para? Near to next to, okay? Mura, it means the wall. Yeah? Have you ever seen the paintings on the walls? Yeah, of the buildings? It's called murals. Yeah, that's why it's here intramural, inside of the wall. Paramural, near to the wall. Is it clear? They could be on the plexuses, which are on the arteries, or the second body could be inside of the wall or near to the wall. Is it clear? Yeah, any questions here? So let's try now to use our knowledge, and we'll try to innervate the stomach, okay? Can you tell me please, do we have in our stomach motor innervation?
No.
So we don't have motor innervation, so that's why we don't make this kind of loop to innervate from this motor pathway, right? Do I feel a pain in my stomach?
Yes.
It's sensory, right? We should talk about sensory. Do we have sympathetic?
Yes.
Yeah?
Yes.
What about parasympathetic?
Yes.
Yeah. Let's start from the easiest one. That will be sensory innervation, okay? The sensory innervation will be starting from the sensory cells in the wall of the stomach. Yeah, we'll get the information and we'll travel through these structures. And who can tell me where is the first neuron of the sensory pathway? Where is
In
that?
the stomach.
Dorsal
Dorsal
root ganglion. Do you agree with that? This is the first neuron of sensory, and the second neuron will be where? In the posterior cortex. That's fine, right? When you get the question innervation of the stomach, this you should tell me for the innervation of the sensory innervation. Okay, let's try to talk about sympathetic, parasympathetic innervation. Yeah. What about sympathetic? Where is the first neuron of the sympathetic innervation of the stomach? Intermediate lateral, right? Will pass through all the structures. Communicants, albicans. Do we form here that synapse? That means they're still preganglionic fibers. Yeah. Then we'll travel to the organ and we'll reach some plexuses. Which plexus is next to the stomach? Celiac, right? I told you celiac, superior mesenteric, inferior mesenteric, aortorenal, and other plexus. The closest will be the celiac plexus, right? On the celiac plexus, we'll have celiac small ganglions. Inside of the ganglions, we'll have what? Second neuron of the sympathetic nervous system. Is it clear? We innervated sympathetic. Now let's talk about parasympathetic. Who knows? Parasympathetic innervation of the stomach.
It's effect on the stomach?
Yeah.
It's
Digestion.
Yeah, it's called rest and digest, so it
Rest and
increases,
digest.
it increases all the functions of the gut.
GIT, just simulating the secretion of the acid, right?
Enzymes.
Yeah, that's good. And we should stimulate it, right? We stimulate it by some nerves. What's the nerve? Which nerve stimulates? Which we're talking parasympathetic. That was sympathetic. Vagus nerve, right? Vagus nerve. It has several nucleuses. Where's the cell bodies? Where's the nucleuses? Brainstem, medulla oblongata, right? In medulla oblongata, we have different kind of neurons, nuclei. One of them motor nuclei, the another one sensory, the another one is the parasympathetic. What's the name of the parasympathetic nuclei? Who knows? Sorry? No. Try to check. What kind of nucleuses do you know in the vagus nerve? That was our previous topic, guys. Ambiguous one and yeah, nerve vagi, right? And the next one, inferior salivary nucleus. Do we have?
Yes.
And the next one, just try to check it. What kind of cell bodies we have? That was your previous home task. Did you find? Tractus solitary is responsible for what? What? No, I'm not telling you that. It's written here. It's written right here, and tell me the name of that. Dorsal motor nucleus of vagus nerve. It's written here for cardiac and visceral. Then we have to the parasympathetic innervation cardiac. See, this is the dorsal vagus nuclei will be the neuron number 1. Okay, it will be in the brain stem. It will exit the brain. How it will exit the brain?
So the foramen.
Good. Then we have some cerebral parts there. Cerebral part, cervical part, right? Then comes the thoracic part. Then comes abdominal part. In abdominal part, we have up to feel like 2/3. We can say that is innervated by vagus nerve. Do you agree with that? Yeah. Then let's. So we are in the cervical regions. We left the cranial, brain stem through the jugular foramen. We're in the cervical part. We give all the brain to the structure of the neck. Then we enter thoracic cavities through which opening? Foramen or structure? Apertura thoracica superior, thoracic superior aperture. Now we are here in the thoracic region. We innervate all the structures, the lungs, trachea, bronchi, heart, and so on. Then we exit thoracic cavity through what? Esophageal opening foramen, right? And we reach abdominal cavity. We have right and left vagus nerve. You remember? Yeah, the left makes turn to the anterior side. The right will go to the posterior side, and they will make plexuses around the organs. Do you agree? Yeah, the first neuron, where is that? Of the What was the nuclei? What was the name of the nuclei? Dorsal nucleus of vagus nerve. This is the first neuron of parasympathetic innervation of the stomach. Yeah. The second neuron will be where it could be laying down. It could be laying down on the intramural, paramural ganglions, or even they can pass through the celiac trunk. They will be the second nucleus, second neuron. Then they will reach the stomach. Is it clear? Yeah. Now we innervated the stomach fully. That should be your answer. The amount of the neurons, first neuron, second neuron, first neuron, second neuron, and the vagus nerve will travel from the brainstem till the abdominal region. You should tell me the first neuron, second neuron, the vagus nerve also. Is it clear? That was the explanation of the innervation, the principles of innervation of the internal organs, including with formation of spinal nerves. Okay? That's it. You can just stop it. Yeah.